Sitting is new smoking.
And it is probably that you are lifting a little heavier than you should. That usually shatters their ego a little.
Yeah, you guys are like the public transport, making us all move.
We get you places. Oh God! Oh God! I can't believe you said that.
Hello and welcome to Beyond the White Coat. I am Shruti and this is Ortho 360 on the move. You know why? Because today we have some really special guests on the show. You know, I honestly love this series because we get to speak to the doctors without their white coats as we get personal with them and have unfiltered conversations. Today we're joined by Aster Clinic's orthopedic surgeons and they're going to talk to us about bones, joints, but we will also speak about their skeletons in the closet. No. I'm just making this up. But we will definitely crack open this conversation. So let's get to the introductions.
First, ladies first, right? So I'm Ambica Nambiar, originally from Kerala, been in Dubai for a while now, and I'm working with Aster at the Albarka branch, and I'm a specialist orthopedic surgeon, more into knees and shoulders.
Hello, I'm Dr. Sushan Singh Bhasin, specialist orthopedic surgeon at Aster Clinic JLT. I'm from Nagpur and I am mostly practicing trauma.
Hi, I'm Dr. Ashwin. I'm from Bangalore basically, been here for a while. I'm an orthopedic surgeon. Earlier I was with one of the most popular clinics, that is the Mutina. Now I am with ASOP, Galgusites. Yeah.
Okay. Nice to have you guys here. Thank you so much for joining us. I mean, I'll start by saying one little confession, and that is I do not like to go to this department, especially because of all the equipment that you guys have. Hammer, saw. Once I saw that, I started taking care of myself.
That's a good one. That's a good one to start with.
We have been called carpenters many a times. So.
Really? But what do you prefer getting called? Surgeon or doctor is okay? I mean, we've spent time.
Surgeon, I think inherently that's what we've studied, so we're surgeons.
Okay, starting the conversation on a lighter note, do you all exercise? Do you like to exercise?
Yeah.
Yes,
Is it like
absolutely.
a mandate? Like, we've never seen a dentist with bad teeth. So is it like a mandate for all the orthopedic surgeons to be like fit?
No, may not
No,
be,
no,
but
that's false.
most of us are active, I have to say, because at least we are conscious of what you're doing.
Yeah. I think, yeah. Because we're a little scared that if we don't do this, we'll end up on the other side.
Now, getting to know you on a personal level as well. Ashwin, what is it that you like to do in your downtime?
I do like to swim, and recently I have started doing cycling. Not very old, say around 2 years.
Okay.
So I would like to cycle. We are doing a good cycling. Thanks to our leaders, Sheikh Hamdan has made one of the wonderful tracks. So I love cycling. Obviously, we go on a professional cycling course.
But so funny, he says just recently 2 years. For 2 years, I would say consistently I'm doing it.
People spend 2 years thinking about it.
I've got a cycle in my house which has been lying there for 4 years. I've only done it twice or thrice maybe. What about you, sir?
Yeah, so I love singing.
I think you have the perfect sound to help you with your pitch.
No, thank you.
No singing?
You would lose your subscribers. Look, I love singing. Whether I sing well or not is a different issue.
Yeah, we will tell you now. We've got two doctors experts in
I
the
think
house.
we are waiting to hear both of you now.
What do you think is going to happen if you say, I love singing?
Oh, no, nothing. Yeah,
We will ask you to sing.
sure.
So it's on you.
So at the end. So apart from that, I love going for camping. So I simply love that. I have my camping stuff in the back of my vehicle at all times. So I like doing that with my kids. And we go to the desert, we go to the mountains. And basically such outdoor activities is what I love doing a lot.
Very orthopedic. What about you?
I have a 2-year-old son, so I don't think I have hobbies right now. I have a son.
I have a son.
Yeah, so that's my hobbies and my free time and my downtime and all my time. No, I'm
your
kidding.
life
But
revolves around that.
I
That's your
know.
son.
So I think no, but I do try. I try. I walk, even though like walking is not the solution that you should do for everything. I try and get in at least a 5K every other day. And I've also recently gotten into swimming. I knew swimming from before. I used to be like the dog in the pond, just splash. I won't drown, I won't die. But recently I've started going for classes and I'm trying to get my, strokes right and all that. And it's a great workout. So yeah, sun, walking and swimming.
Okay. Oh, nice. How long have you been in Dubai though?
I was actually here since '96.
Okay.
I did my schooling partly here. So I went back to India, did my, schooling completion was there, then medical training, then now life's become a full circle and I'm back here.
Awesome. What about you, doctor?
So I've been here from 15th August 2022.
Independence Day.
What
Oh,
did
no,
you leave behind?
No, and it was a great day. I mean, we are really grateful to the government of UAE for all the infrastructure that they have created here, and the wonderful lives that we are able to lead here is all because of that. And it's a momentous day for me and my family as well.
What about you, doctor?
Look, you asked the question in the right day because today marks my 9th year of coming to Dubai. So 8th May was the day I landed in Dubai where Aster took me in. And it was a very warm welcome. I even remember every moment of that day.
So you have been with Aster ever since you arrived in Dubai?
Correct. In between or a short period I was out. So, but on the day I came, so it's been 9 years with Aster almost. Yes.
Come on, you guys can do it. Come on. Okay, so starting off the conversation about orthopedics. Ashwin, we'll start with you, doctor. How did you start? Like, what did you, when was the day that you decided this is what I want to do?
So two things. One is my dad is orthopedic surgeon where I got my inspiration from. So that is one thing. And when I was in MBBS, like I used to see all the ortho doctors, like basically they're all cool and they work a lot. At the same time, they enjoy a lot. So this pushed me to take orthopedics. The other way around, it's not easy subject, honestly speaking. So yes, that's how I came into orthopedics. It's more of a practical thing than a typical of vocation, most of the ortho, like the other subjects.
Okay. What about you, doctor?
So mine begins with a personal tragedy. So the day I passed my MBBS, I entered my home. We had a huge sliding gate. So I parked my bike and my sister closed the gate. And the gate was a sliding one and it just came off the rails. And it was a half a ton gate and it fell on my leg. So I had a fracture. But after that I was taken to one very senior orthopedic surgeon in Nagpur, a thorough gentleman, and just the entire feel of that place and the way he used to be with his patients, and more importantly, the way the patients used to regard him. It just was it was so inspiring that for me, whenever I remember that time, I don't remember the gate falling as much as I remember the hospital and the feel of it. That just triggered this love for orthopedics in me.
Okay. Dr. Ambica, you?
So mine, I think, my internship, I think, worked hard, but I also partied a little bit. So I had a bit of an extension, and that happened to be in trauma. And I think that changed my mindset or perception about orthopedics because the kind of recovery that patients make, especially trauma, they come to you, they can't walk, or they're in immense pain, and you do one procedure, and the next day they're using supports, but they're walking. So the kind of gratification that gives you, the kind of it's you see the recovery, so it's kind of like a high, and so I think that's where my love for ortho began.
What is that one myth about orthopedics that really drives you crazy?
I think I'll allow them to talk first.
No, we decided we're going to start with you every time. You said you're going to talk less. Now you have to talk.
No, the people tell that like it is like a major problem that I have and there is no solution for this. That may not be true all the time. See, so we are there to help them, of course. On the other side, they feel that this is going to be a tough thing. So that's not actually the tough thing. See, many times we solve the things and we have a fracture patient coming back to us after 3 days, like with all smiles, and they tell me to remove the plaster. See, so it's a myth that I'm going to be on bed and I'm going to not walk. It's not true actually. So that's the myth people have, that when I go to orthopedic surgeon, it's all about rest and treatment, and so may not be many
That
times.
is something that we like though. that's not a myth we mind. Yes, doctor, about you?
Yeah, so we have a lot of people, especially where my clinic is situated, we have a lot of runners there. And with the number of marathons which keep occurring all over. So these people will keep running with knee pains, and they will just keep on thinking, it's okay. It's just a part and parcel of running, and that these are all muscle aches and stuff. But there, you could have meniscal issues, you could have cartilage damage. There could be malalignment issues as well, which might not have ever been looked into. Sometimes the pain may be in the knee, but the issue lies with the foot, the way it is landing, the way it is planting on the ground. So that is one thing which I think is a myth with a lot of people, that they just think that probably it's just a part and parcel of running.
Okay.
With me, I think in practice, I do see a lot of women. I think they must also be seeing a lot of women who come and say that, I had a cesarean delivery, that's why I have back pain. So they kind of attribute the fact that, there's a surgeon who's either operated, the problem either lies with the incision here, or most commonly they think that they've taken the injection on the back, so now that back pain, they'll tell us also, that exact spot where he poked the needle, that's where I have the pain now. That would have happened 8 years ago. Okay. No connection. I know the needle looks big and scary, and some people don't have to go through with the needle also, but that, to be honest, has nothing to do with a disc problem, which is mostly the cause for back pain amongst women. But I think that's a myth that lot of women have, or they keep in their mind that, I had an epidural or I had a cesarean, so I will have back pain. It's got to do a lot with you're carrying a pregnancy, a lot of hormonal changes. So I think all that contributes, not the spinal needle, no.
I second that, because they're scared of that spinal needle. So I tell my patients, it's just 0.2 mm. So they'll take the whole thing to the back pain to that needle.
And many a times what happens with these females is that they will end up having back pain, say 2 years down the line, so after their delivery. So it could very well be a lifestyle issue that they are having, but it is human nature to try to find an immediate reason for things. So they tend to find, okay, what was it that happened to my back? Okay, the last thing which happened to my back was that I got an epidural.
And to add to that, actually, that could also be carrying the kid, because you say that you
Correct.
always
Could
try and
very well
carry
be.
everything like
Also,
this, but you have it on
because
one side or one side.
Yeah.
Once during pregnancy, once the uterus comes out of the pelvis and into the abdomen, the entire way that your body weight gets distributed changes. So there is something like a center of gravity of your body which tends to shift forward, and to bring it back to the position, you tend to arch back, and that constant pressure for months together can lead to such kind of back issues. So there are a lot of issues, there are a lot of things which could be there, epidural being the last of them.
Yeah, correct.
And they also don't exercise.
Yeah, that's true.
Most of them, they got busy with the kid, work.
I think when you say myth, right, I think it all starts when you say normal vaginal delivery and cesarean section. Both deliveries are normal. Like, your body is responding to something. You have had a cesarean because, your baby has to come out. That's normal. It can be either with the scar or without the scar via the vaginal route. But the minute we say you had a normal delivery, no, I had an abnormal delivery. Cesareans are not abnormal. So I think the myth kind of starts from there when you start.
Got to normalize that.
Yeah.
Right.
So they blame everything on one reason, which is not true. Yeah, it's not true.
Okay, so we obviously know that you all carry a hammer, which means that you are no less than Thor. So what do you think is your superpower, orthopedic superpower?
We make them mobilize fast. I think that is a big superpower we have. I've seen patients walking even after the surgery. So that itself is a big thing for us, and both of us are happy saying that.
Yeah.
Back in India, I used to do a lot of deformity corrections and a lot of bone transport surgeries, and to see people like completely lose their hope of ever walking again or even moving their limbs again, and to come back to doing that, that is very gratifying.
Yeah, you guys are like the public transport, making us all move.
Somewhere, yes, we land there.
We get you places.
What about you, doctor? What's your superpower?
I think it might be a little more mellow than theirs. I think it's just being heard, because I feel like sometimes patients, they come to you and they say that you have knee pain for this. I don't think it's anything, but they would have had a cartilage problem or a meniscal problem. And then when you tell them, it's okay, this is your MRI report, it says that you have I didn't think that it was so bad. Like, I just thought it was knee pain. Like, so they're going through a lot, and it's going internally within them. They're conflicted as to, because what will happen is when they're resting, they get up in the morning, they feel, now there's no knee pain. But the minute they're actively doing something, then they feel the pain again. So So I feel like when they come to us, they heard, or at least to me they heard, and then they feel like, okay, so now she's identified the problem, now I'm sure there's going to be a solution. So I think that would be a superpower.
Yeah, great. Actually, that leads me to the next question. What are the pains that people generally normalize and think that it's just nothing, but it could be something? I'm going to leave the floor open. Whoever wants to answer first. Ashwin, there's no no pressure on you anymore.
I have two best speakers other than me. They can take the stage. So, like I told, one of the
You
things.
only started. You can't put that on me anymore.
No, I'll be not blaming that. So people come with fractures walking. So they come to us. Recently, I had a patient who came with a swollen leg, meaning almost 3 times the opposite side, and he takes it normal. So I told it's not normal. He tells me there's no pain, doctor. So when you go through, there is a fracture. So, but he's walking absolutely no pain. So that time you need to convince them that you have to take something. Otherwise your swelling will not calm down. So this is the thing, people have that feeling, no, that I'm good, nothing is there, but they like something else.
Oh, that makes me wonder. I think your superpower is also X-ray vision.
Yeah. Vision is very important, yes.
What about you, doctor? What do you think is dismissed as normal?
I frankly think that I belong to a very fit clinic, because I have a lot of patients who are coming with fitness issues.
As you told, they're all
From
runners.
reality.
They're all runners.
Runners.
And so I'll have a lot of gym girls who come to me and complaining of chronic elbow pains. And they'll still keep on lifting weights, and they'll say, doctor, I don't know, like what happens. This hurts a lot whenever I lift weight. Whenever I'm not lifting, I'm much better and stuff. And then I would examine them, and in most of the cases it would be a tennis elbow which will come up. And when I tell them, the problem is not with your elbow, it is with your wrist, it is with the way you are lifting weights, and it is probably that you are lifting a little heavier than you should. That usually shatters their ego a little. How you say that I'm lifting heavy? You are lifting heavy. You are not supposed to lift that much. Your forearms are not able to keep up with your biceps or your triceps or your shoulder. So yeah, I mean, that is what it is. So then when we educate them and we let them know that, okay, this and this is the issue. This is why I'm asking you not to lift that heavy, because your wrist position is probably going off. You're not able to keep up with it. And once they start implementing those things, when they rest it a little, when they do physio for that, they get back to their workouts and they start implementing what was told to them, they'll come back saying that, yeah, doctor, that worked. That worked.
Nice. True. Again, I think we started with you, so the back pain thing is what people discuss as normal. Okay. What's the...
Actually, one superpower that I have, I don't know, I mean, I think that you people must be also having this.
How you people must be also...
Yeah, I'm pretty sure a lot of...
gang, we're like the Avengers. You have, I have.
Once the patient comes in, within the next 5 seconds, I will know whether the patient is coming for a sick leave or the patient genuinely has an issue.
Doctor, may I have your number, please? Now I know which clinic you are at, so I know what to do.
On the sick leave?
Yes.
He might be right many of the times. Yeah.
He's got, you guys have got the power to grant us leaves,
Yes.
which our boss disapproves.
And also very politely refuse.
Oh no.
Yeah.
That's the sad.
Many times we know what really there is a problem or not, we can know it.
Funny you should mention that, because that's the next question that I want to ask. What is the funniest thing that your patients have ever done to you guys or said anything to you?
This has happened many a times. So fractures are supposed to be like very painful. And I will have kids coming to me with wrist fractures or finger fractures, and their mothers will be crying their eyes out, fathers will be under stress, and the child's first thing would be, okay, so it means that I don't have to write over the next 1 month? Yes.
Priorities.
Priority is a priority.
I know.
So yeah, that is one thing which keeps happening very frequently with me.
I had once, I had not once, actually twice, but I had a patient, I remember her face. She came to me and she said she has some knee pain and all that. And I said, so the knee was quite swollen and she did have some difficulties. I think the husband was supportive but slightly dismissing the problem because she's having it for a long time. So she's going to go, I examined her and I said, I suspect this is what you have. And she goes out for an X-ray and she comes back and she says, can you tell him I can't cook? I am fed up. 1 week I need bed rest. You tell him. Like, you just tell him it's bed rest. You tell him I have to lie down full time. Please, doctor, please, just do this for me. I said, okay.
I mean, sick leave from something else also.
You don't even need a proper sick leave for that. It's just a doctor's word is enough.
Yeah, this is a common thing I'll also get. So they'll sneak in, mainly the kids. Please tell her that I'm not going to write. I'm not to write. If you can give a letter that my teacher also knows it, that I don't want to write. Very commonly kids ask, yeah, they want to be completely rested.
Okay, talking about kids, when you reach your 20s, is there anything that we all can do to extend our joint health? Like, there's anything that we can start in our 20s which can help us be healthy for much longer?
Absolutely, yes, that's the right time, and I think you asked the right question. So, joints are meant to move. So, what we learn from the orthopedics is that all the joints should be moving, and all the joints should be at active. So, recently they published that sitting is new smoking. That they published the paper in AIMS. So I think they have to start moving. At the same time, see, many have a feeling that if I walk for 5 kilometers, I'm done with my. No, that's not right. I tell many of them. See, if you're doing that, you need to stretch. You need to do a lot of stretches, concentrate on your muscle. Muscle is the one which is going to be taking care of you over time. So many people don't take muscle stretches and they don't do any muscle, honestly speaking. So I think they should concentrate more on that.
Strength training is one thing which I would say that 20s is the right time when you have metabolism at your side, when you have strength at your side, and building muscle strength and hence muscle mass in your body. It'll help you with the mobility part. It will help you with delaying fat accumulation. It's a very natural mood booster. Like a lot of endorphins get released when you start doing exercises, and so basically regretting it later in your 30s and 40s when you start saying that, oh doctor, I walk so much and still I don't lose weight. I think that can very well be dealt with in your 20s itself. If you are lifting weights, it's not just about lifting weights, it is about making your muscle work against some form of resistance is what is required. You don't have to go for an overkill. You don't have to go 7 days a week, 3 to 4 days a week. If you are doing this thing, if you are generally moving well, and if your diet is generally clean, there is no issue at all. These things, will take care of you for a very long time.
Sorry, I'll add to that. We started playing paddle very recently, and I was not able to lift that bat because it's slightly heavier. You will not believe, I just used 1 kg dumbbell in the gym. And when I lifted it also, I was like, what is this funny thing that I'm doing? But that miraculously changed everything for me at the court, which was just amazing. So that little change.
I have many paddle players coming. And they are all like part-time paddle players.
Suddenly they start.
Yeah, 2 weeks mein ek baar they'll be going and they'll be paddlers. And most of them would be coming with this tennis elbow issues. A lot of them would be coming with shoulder pains. And in all of those cases, I would say that you want to enjoy playing paddle tennis, you just stop for a few months. Wait for 3-4 months. You start doing strength training. Once you start doing strength training, your muscles are used to that. There is a good neuromuscular coordination, there is a good brain muscle coordination that you are able to set in. And then when you start playing sports, and it's just not about paddle, it's about a lot of others. Paddle is still a very low energy kind of sport. People are playing tennis, people are playing football, basketball, badminton, things which have explosive movements. And whenever you are doing explosive movements, you should have a certain amount of neuromuscular coordination, which has to be there. Unless and until that is there, you will have a lot of injuries which come up.
Okay, talking about that, what are the things that gym goers and probably runners do not understand, or you wish they would understand better?
I think first thing I will tell is don't overdo.
Okay.
Many of them are overdoing it. Honestly, not to go against any of the gyms or any of the trainers, but you need to know your body first. What you're supposed to do, what you're not supposed to. Your body will tell it. So he goes, lifts weights for 1 hour, and next day he comes back to us with a lot of pain. So that's not the right way. I think you should go slow.
Ego lifting is something which is an issue in the world of Instagram, when you have to prove to, okay, you are lifting 25, I'll be lifting 30. It doesn't work that way. at the end of it all, we are looking for fitness. We are looking for a happier life, a pain-free life. And for that, if lifting weights is the thing, I think it is better to go for a lighter weight and more number of repetitions. At the end of it all, it is the volume of the workout which
And also
matters.
the pace. The pace is very
yeah,
important.
It has to be very
Slow and steady. Yeah.
Exactly. It has to be very controlled. The movements have to be very controlled. Your posture has to be extremely measured. You cannot be just lifting
Yes.
anything like what you. I mean, you might be able to lift a 50 kg dumbbell, but whether you are supposed to do that is a different issue.
That's a question they have to ask themselves. Yes.
So because probably for me, a 10 kg dumbbell would be very heavy. For him, maybe a 20 kg dumbbell might
For
not be
me,
heavy.
1 kg worked. So it's fine, absolutely okay.
So everyone has to find their own sweet spot. Like, what is that weight at which my joints are not getting strained? The muscle which I'm trying to target is the only muscle which is getting worked upon. That is what people need to do.
Many of them, they try to push the trainers also. No? They want to get back to the fitness that stream soon. So the trainers also will obviously go with that kind of pressure. I think
it's
that
got
is
to
not
do
the right
a
way.
lot with social media, isn't it?
Yes,
Like
yes,
because
100%.
everybody wants to post things online about their recovery, about the kind. Yeah.
Transformations and
One
flatter
thing-
bellies and stuff.
Yeah, one thing I find which is very common amongst especially gym goers more than anything is that they focus a lot on upper body strengthening. They don't focus on their legs and they restrict leg day to like once a week and all that, which is not good because your entire body weight is taken up by the legs. So you need to focus. Legs should be actually ideally given at least 2 or 3, days in a week. So that is something because when you're posting for the gram, it's mostly above here. So I think I think a lot of people miss out on doing that and they end up with lower back issues and knee and leg issues. So I think that is something that gym goers should be a little more aware about, especially the gram.
And recovery is one thing. I think recovery is much more important probably more important than the exercise itself. Because what we do while we exercise is that we are tearing the muscles apart for them to be rebuilt. So herein comes the role of nutrition. Here comes the role of your sleep. Sleep is extremely important.
That most important.
You can't say that I sleep for 4 hours a day. I feel well rested. No, you aren't.
Yeah, correct.
The warm up and warm downs should be the criteria for everyone. I think most of us miss out. Even we sometimes we don't do warm downs. Like we rush out and come back to our routines.
Correct.
I think warm down is very important after any exercise. That's what I feel.
So with this, we have come to the end of our conversation, but we begin the rapid fire with y'all. I have taken the liberty to name this rapid fire Bone to Pick with You. Okay, so the first question is, crackling your knuckles causes arthritis, true or false?
False.
False.
Okay. Only old people get joint problem.
False.
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 Women are more prone to osteoporosis than men.
True.
True. Okay. Calcium supplements alone can prevent osteoporosis.
False.
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 A backpack should never be worn on one shoulder.
Correct.
Which activity causes the most number of fractures? Sports, stairs, or sheer stupidity?
Sheer
Say
stupidity.
stupidity, of course.
They say rib tickling comedy. So which rib is getting tickled by comedy? Is there any truths to this?
Not really.
Tough thing to answer.
So no rib tickling happening in comedy?
No, not really. No.
Okay, what's the worst bone to fracture?
Spine, of course.
Yes.
Spine, of course. Makes you
When
really.
you fracture your spine, you lose a function in a lot of other parts of the body.
Okay, which is the most useless bone in the body why are you in here?
I can tell fibula. Yeah, fibula is one of the bones in your legs.
Yeah, you find all these small bones, na? When you find sometimes on your toe starts going that way and all that, the hallux valgus. So those kind of small bones, they're kind of useless.
Okay, they are useless as a trying to get out.
And hyoid.
It's a lot of bones are there.
Okay, so we can actually do a show, a proper episode
Useless
on that.
bones, I know.
Useless bones in the body. Okay, ever seen a fracture and thought, now this is creative? How did you do this? Yeah?
I'll have to think about it.
There are challenges. At the same time, there are very tough things also to see like that. Yeah, a lot of things. Yeah.
So do you guys judge the patient who comes in with a random fracture? Ki, "Achha,
Absolutely.
Okay, now. This is what we're dealing with today.
What do you think we were talking about before this started? just talking about all these random.
I hope you didn't judge me on my posture.
We won't tell you that.
You won't tell me that? Oh boy. Okay, lastly, is there a funny bone in the body? Yeah, it is. It's called humerus.
Oh, yes.
All right, so with that, we have come to the end of today's Beyond the White Coat. We'll see you again next time.